You're lying on the operating table. Anesthesia kicks in. The world fades. And that's when the real conversation starts. Surgeons have secrets, not the kind that'll get them fired, but the kind they'd never admit to your face. Today, you're getting the unfiltered truth from inside the OR. No sugarcoating, no hospital PR. Stay with me. You'll never look at surgery the same way again. Surgeons talk. A lot. Think surgeons are silent, laser-focused monks during your procedure? Think again. The moment you're under, the OR turns into a podcast studio. They're talking about their weekend plans, their kid's soccer game, what they're having for lunch. Sometimes, they're even playing music, classic rock, hip-hop, Taylor Swift on repeat. One cardiac surgeon admitted they've had full debates about Marvel movies while operating. Another said they once rated every fast food chain's fries during a 3-hour procedure. But here's what matters. This isn't a distraction. It's focus. Studies show surgeons who talk during surgery actually perform better. The casual banter keeps stress low and minds sharp. Silence? That's when things get tense. That's when mistakes happen. So if you could hear what's happening while you were out cold, you'd probably hear your surgeon debating whether a hot dog is a sandwich, right before they stitch you up perfectly. And honestly, that's exactly how it should be. The "oh no" rule. Here's something that'll keep you up at night. Surgeons have a rule, an unspoken code. If something goes wrong during surgery, really wrong, they never ever say "oh no" or "uh-oh" out loud. Why? Because everyone in that room is listening. The nurses, the anesthesiologist, the surgical residents. And if the lead surgeon panics, the whole team spirals. Instead, they use code phrases: calm, clinical, boring. Let's slow down here. Can we get a consultation? Interesting finding. Interesting finding is surgeons speak for, this is not going according to plan, but we're handling it. One vascular surgeon said they once nicked an artery during what should have been a routine procedure. Blood started pooling fast, but instead of freaking out, they calmly asked for more suction and said, let's irrigate and get better visualization. The patient never knew. The family never knew. The OR report? Totally clean. Because in surgery, perception is reality. And a calm surgeon is a competent surgeon, even when things go sideways. They know if you smoked or drank. You lied on your intake form. Said you only drink socially. Said you quit smoking years ago. Your surgeon knows. The second they open you up, your body tells the truth. Your lungs, your liver, your blood vessels. Everything talks. Smokers, their tissue looks different. Grayish, less elastic, harder to work with. It bleeds more. It heals slower. Drinkers, fatty liver shows up like a neon sign. Surgeons can literally see years of Friday nights in your abdomen. And they're not judging you morally. They're judging risk. Because your habits directly affect how you'll heal, how you'll respond to anesthesia, and whether complications will pop up post-op. One general surgeon said they had a patient who swore they'd never touched a cigarette. 5 minutes into surgery, they saw the lung tissue and knew. This person was a pack-a-day smoker. Easy. They didn't confront the patient, but they did adjust the surgical plan, took extra precautions, ordered different post-op care. So here's the takeaway. Your surgeon isn't your priest. They're not there to absolve you. Just tell them the truth, because your body will anyway. Surgeons are impatient. Let's be honest. Surgeons aren't known for their patience. They're not sitting around taking deep breaths and practicing mindfulness. They're type A, high speed, get it done yesterday kind of people. That's why they became surgeons. In the OR, this works. Speed matters. Decisiveness saves lives. But outside the OR, that impatience leaks everywhere. They get frustrated when residents move too slow, when equipment isn't prepped perfectly, when the schedule runs behind because someone in pre-op took too long asking questions. One ortho surgeon confessed they've literally tapped their foot during timeouts because we all know what we're doing. Let's just get in there. But here's the thing. Impatience isn't always bad. It creates efficiency. It pushes the system forward. And honestly, you want a surgeon who's a little bit impatient because they're not going to waste time. They're going to get in, do the job right, and get out. Just don't expect them to sit and chat about your feelings for 20 minutes. That's not their lane. Time pressure is real. Surgery isn't just medicine, it's a business. And that means your surgeon is on a clock. Operating rooms cost hospitals thousands of dollars per hour to run. Every minute over schedule is money lost. Every delay creates a ripple effect, pushing back other surgeries, frustrating staff, clogging up the system. So surgeons are under constant time pressure. Finish on time, stay on budget, keep the OR efficient. One neurosurgeon said they've had hospital administrators literally track their minutes per case and give feedback on improving speed. Does this affect patient care? Not directly. Surgeons won't rush through critical steps, but it does affect everything around the surgery. How much time they spend talking to you before, how long they linger after, how much they explain. And sometimes it affects which cases they take. Complex surgeries that'll run long? Some surgeons avoid them because it messes up their metrics. This isn't a knock on surgeons, it's the system. Medicine has turned into a tightrope walk between patient care and profit margins. And your surgeon is walking that line every single day. They have rituals you'll never see. Before your surgeon walks into the OR, they do something you'll never see. A ritual, a superstition, a tiny act that centers them. Some surgeons listen to the same song before every case. Others have a specific pair of socks they wear. One cardiothoracic surgeon eats the exact same breakfast before every major procedure. Black coffee and a plain bagel, no exceptions. Why? Because surgery is high stakes. And when the pressure's on, humans crave control. Rituals create a sense of order. They calm the mind. They trigger focus. One surgeon said they touched the door frame of the OR 3 times before entering. Been doing it for 15 years. Never missed. Another taps their scalpel twice on the tray before the first incision, every single time. It sounds silly, but these tiny acts, they're what keeps surgeons sharp, confident, ready. Because when you're holding someone's life in your hands, you'll do whatever it takes to get in the zone. Even if it's something as simple as wearing lucky socks. They remember the tough ones. Ask any surgeon about their first complication, their first loss, the case that still haunts them. They'll remember everything. The patient's name, the time of day, what went wrong. Surgeons carry these cases with them, not because they want to, but because they can't forget. One trauma surgeon said they still think about a patient they lost 8 years ago, a motorcycle accident. Everything went right technically, but the injuries were just too severe. They replay that surgery in their head constantly, wondering if there was one thing they could have done differently. This is the part people don't see. Surgeons aren't robots. They feel the weight of every outcome. The successes fade, but the tough ones, those stick, and it makes them better. Be more careful, more thorough, because every surgeon knows there's always another case, another life, another chance to get it right. Not all surgeons like each other. Hospitals are full of egos, and surgeons, they've got some of the biggest. Not all of them get along, not even close. Some have feuds that go back years, disagreements over technique, clashes over OR time, personality conflicts that never healed. But here's the crazy part. They still work together, professionally, effectively. Because when you're in the OR, personal beef doesn't matter. The patient matters. The outcome matters. One anesthesiologist said they've watched 2 surgeons who openly can't stand each other perform a 6-hour procedure together without a single issue. Total professionals, communicated perfectly, saved a life. Then we walked out and didn't say a word to each other. That's the surgeon code. Leave the drama outside the OR. Do the job. Save the patient. They have dark humor. If you ever walked into a surgeon's lounge, you'd be shocked. The jokes are dark, like pitch black dark, morbid, twisted. They laugh about things that would make normal people uncomfortable. Failed intubations, bizarre injuries, the weirdest things they've found inside patients. But this isn't cruelty, it's survival. Surgeons deal with death and suffering constantly. If they didn't laugh, they'd break. Humor is how they process, how they cope, how they stay sane. One ER surgeon said, "If we took everything seriously all the time, we'd never make it through a shift." So they joke, they laugh, They make inappropriate comments that would never, ever leave the break room. And it works, because the next case comes, and they're ready. They see what others can't. Surgeons have a sixth sense. They walk into a room and know something's wrong before labs come back. Before imaging confirms it, they just know. Years of experience create instincts that are almost supernatural. They see patterns others miss. They feel complications before they happen. One surgical attendant said they once canceled a routine gallbladder removal because something felt off during pre-op. Turned out the patient had an undiagnosed clotting disorder that would have caused massive bleeding. That instinct saved a life, but it's not magic. It's thousands of hours, thousands of cases. Pattern recognition burned into their brain. Trust that instinct, because when a surgeon says something's not right, they're usually correct. Not all surgeons are the same. Here's the uncomfortable truth. Not all surgeons are equally skilled. Some are exceptional. Artists with a scalpel. Others are competent. They get the job done, but they're not winning awards. And patients rarely know the difference until it's too late. Hospitals don't advertise surgeon success rates. You won't see complication stats on the wall. It's all hidden behind closed doors. So how do you know if your surgeon is good? Ask other doctors. Seriously. Doctors know who they'd go to if they needed surgery. That's your answer. Check volume. Surgeons who do a procedure frequently are usually better than those who do it twice a year. And trust your gut. If a surgeon dismisses your concerns or rushes you, find someone else. Because surgery is personal, and you deserve someone who treats it that way. Behind every mask, there's a human being. Skilled, impatient, imperfect. They hold secrets not to deceive you, but to protect the system that keeps us alive. Because if we knew everything that happens in the OR, we might never have the courage to walk in again. But maybe that's okay. Maybe some secrets are meant to stay in the operating room. What matters is this: surgeons show up. They do the impossible. They carry the weight. And tomorrow, they'll do it all over again. If this opened your eyes, hit subscribe. More untold truths from the hidden world of medicine are coming soon. Until next time, stay curious.